Imagine being sick, and instead of a pill, the doctor shows up with a red-hot iron and says, "Don't worry, this will cure you." Sounds like a scene from a horror movie, right? But that was the reality in the Middle Ages. The medicine of that time was a mix of belief, superstition, and a tiny, very tiny bit of science. Diseases were a mystery, and any symptom could be interpreted as divine punishment, an imbalance of the body's humors, or even the influence of evil forces. And, of course, the treatments followed that logic. The problem? Many of these cures were more painful than the disease itself. It's like going to the dentist with a toothache and leaving with half your mouth burned because someone thought heat would drive out the evil. A shocking example was the use of cauterization for practically everything: high fever, wounds, infections, even vision problems. The patient was restrained, the iron heated until it glowed, and, well, you get the idea. They said it was to seal the disease in the body, but in practice it sealed the patient's patience, and sometimes their chance of survival. The most curious thing is that for them, this was cutting-edge medicine. While today we use anesthesia and antibiotics, back then the only relief was praying, literally. And often after the treatment, the patient needed another treatment because of the first one. Would you have the courage to undergo something like that? Now imagine this: you're pale, feverish, weak, and the doctor decides the best solution is to drain your blood. No, it's not an exaggeration. This was the most popular procedure in the Middle Ages: bloodletting. The theory came from ancient Greece and held that the body was governed by 4 humors: blood, phlegm, yellow bile, and black bile. If one was in excess, it caused disease. And to balance it, nothing better, according to them, than opening a vein and letting the liquid flow. The curious thing is that for almost any symptom, the answer was the same: headache, bloodletting; infection, bloodletting; fatigue, bloodletting too. It was a one-size-fits-all universal cure. Today it seems absurd, but back then it was as common as taking a painkiller. The methods varied, sometimes with direct cuts, other times with leeches. Yes, small worms were placed on the skin to slowly suck the blood. Some doctors swore this was more precise and natural. The patient, of course, probably didn't find it so romantic. The problem is that instead of improving, many people became even weaker. And if the disease didn't kill them, the blood loss might finish the job. But back then, the logic was simple. If the patient died, it was the disease's fault, never the treatment. Sounds like something out of a nightmare, doesn't it? But that was the modern medicine of the Middle Ages. Imagine having a cough and being given a remedy made of honey, herbs, and mercury. Yes, the same toxic metal we now handle with extreme care was once an ingredient in medieval medical preparations. The idea was that strong substances could expel the evil from the body. And mercury, being shiny and alive, it moves in droplets, seemed magical to the healers of the time. They believed that if it could kill parasites, it could also cure fevers, respiratory problems, and even skin diseases. The result? In small doses, the patient would feel dizzy, sweat, and vomit, signs the doctor interpreted as the poison leaving the body. But in reality, it was the body trying to survive poisoning. In larger doses, well, you can imagine. The scariest part is that some syrups mixed mercury with opium, creating a cocktail of temporary relief and slow poisoning. The patient might feel better for a few hours, but the price was high: damage to the kidneys, liver, and nervous system. And don't think this was limited to small villages. Even court physicians recommended it. For them, if it worked for a king, it worked for anyone. Of course, no one kept track of how many cured patients never got out of bed again. Today, we get worried just hearing about mercury in fish. Imagine drinking a whole spoonful thinking it was saving you. Now take a deep breath and picture this. You have a throbbing toothache, and the medieval dentist, who was often the same guy who sharpened knives and fixed pots, decides the only solution is to pull the tooth with iron pliers. No anesthesia. In the Middle Ages, dentistry was basically an exercise in bravery. Cavities, abscesses, and broken teeth were common, but no one knew how to treat the cause. So the solution was simple: yank the problem out by the root, literally. The most commonly used instrument was the pelican, a type of metal lever that looked more like a butcher's tool. The dentist would hold the patient's head with their knee, fit the iron around the tooth and pull. Sometimes the tooth came out. Other times it broke in half, requiring multiple attempts. And don't think the torture ended there. Without hygiene techniques, the risk of infection was enormous. Some applied hot wine or vinegar to the mouth to clean it, which stung so much the patient almost forgot the original pain. Almost. The most curious part is that, in fairs and public squares, these extractions were performed as a spectacle. People gathered to watch, as if it were a show of skill and strength. Today, it's hard to imagine anyone paying to see that. Would you have the courage to sit in the chair or on the crate of a medieval dentist? Now hold on to this one. What if your doctor said that to cure a headache, he needed to drill a hole in your skull? Yes, in the Middle Ages, this wasn't fiction, it was a real procedure. Trepanation involved drilling through the skull bone to expose the membrane surrounding the brain. It was believed this would release evil spirits trapped in the head, balance the humors, or relieve pressure from injuries. The method dated back to prehistoric times, but survived for centuries. And the most surprising thing, many patients survived. Of course, not without consequences. Without anesthesia, the pain must have been indescribable. The sound of metal scraping bone was likely etched into the memory, and probably the nightmares, of those who went through it. There was also a mystical side to the process. Some doctors and healers believed opening the skull connected the patient to spiritual forces, enabling a cure that came not just from the body, but also from the soul. The problem was that, without proper hygiene, the risk of infection was sky high. And if the patient didn't die during the procedure, they could develop fatal infections days later. But by the standards of the time, it was seen as a necessary sacrifice. Today, just thinking about someone tampering with the brain without modern technology sends chills down the spine. But for them, it was an act of hope. When we talk about medicinal baths in the Middle Ages, forget the relaxing image of a warm tub with aromatic salts. Often these baths were true human stews. The belief was that boiling water could purify the body, kill diseases, and expel bad energies. So some treatments involved submerging the patient in wooden barrels filled with near scalding water, sometimes mixed with herbs, wine, or even vinegar. The problem was that the near scalding wasn't always so near. There were no thermometers, so the temperature was judged by eye. And depending on the healer's enthusiasm, the result could be second-degree burns. Some accounts describe patients with conditions like arthritis being submerged until their skin turned red as a shrimp. And if they screamed, well, that was interpreted as the evil leaving the body. Zero comfort, almost no science. There were also contrast baths, soaking in hot water followed by buckets of ice-cold water. The idea was to shock the disease out. In practice, it was more a test of physical endurance and luck, not to catch pneumonia in the process. Curiously, for those who survived, the treatment sometimes seemed to work. Perhaps because, after so much suffering, any improvement felt like a miracle. Would you have the courage to step into one of those barrels, believing you'd come out cured? If you think it's bad to apply a strong-smelling ointment, get ready to learn about medieval poultices. These mixtures were applied to the skin to draw out diseases from the body. But what was in them could make anyone lose their appetite. Depending on the ailment, the healer would prepare a paste using animal fat, ashes, herbs, and brace yourself, sometimes even human or animal feces. Yes, literally. The belief was that certain ingredients had magical or medicinal properties capable of expelling poisons and infections. For wounds, one method involved covering the area with this mixture and then wrapping it in cloths, letting it sit for days. The smell, as you can imagine, was unforgettable. And the risk of attracting more bacteria than repelling was enormous. Some poultices were heated before application, which, besides intensifying the odor, could cause burns. Others, when dry, hardened like cement, making removal a challenge. The most curious thing is that every now and then they worked, not by magic, but because some of the herbs used actually had antiseptic properties. But amidst so many questionable ingredients, any positive effect was almost accidental. Today, just thinking about applying a cream with those ingredients gives you the chills. But back then it was considered serious and even valuable treatment. Would you have the courage to try a poultice like that if it was your only hope? In the Middle Ages, it was believed that many diseases came from impurities accumulated in the body. And what was the solution to clean everything out? Forcing a complete purge. In other words, giving the patient a laxative so potent they'd spend the entire day running to, well, you get the idea. These remedies were made with unpleasant combinations: castor oil, bitter roots, strong vinegar, salt, and even small doses of heavy metals. The idea was to trigger rapid evacuations to expel the evil. The problem was that, along with the supposed impurities, the patient also lost essential fluids and minerals. The result? Extreme weakness, dizziness, and in some cases fainting. And of course, without modern bathrooms, the experience was even more embarrassing and unsanitary. Some healers combined laxatives with diuretics, creating a medieval detox combo that left the patient exhausted in a matter of hours. For them, if the person emerged from the treatment pale and thin, it was a sign the cure was working. The most curious part is that certain ingredients, like fennel seeds or mint, could actually help with mild digestive issues, but the exaggerated mix of components made any beneficial effect vanish amidst the intestinal storm. Today, the idea of taking something so strong is frightening, but back then, it was considered one of the most effective ways to cleanse the body. Would you accept a treatment like that, knowing you'd spend the whole day suffering? In the Middle Ages, many alchemists and doctors swore they had discovered formulas capable of prolonging life or even granting immortality. These were the famous elixirs, liquids made with mixtures as exotic as they were dangerous. These potions could contain powdered gold, ground pearls, rare herbs, honey, strong wines, and, brace yourself, arsenic in tiny doses. The logic was strange. If a poison in small amounts didn't kill, it could strengthen the body against diseases. Some of these elixirs were sold at exorbitant prices and promised everything from curing illnesses to rejuvenation. Kings, nobles, and even clergy drank them confidently, believing they were gaining extra years of life. The problem? The most noticeable effect was slow poisoning, with symptoms like nausea, hair loss, chronic pain, and of course, premature death. The most fascinating thing is that the appearance of the potions was deliberately eye-catching, golden, shiny, aromatic. This gave them credibility, as if the liquid's beauty was proof of its power. And in the absence of scientific methods, faith in the product did half the work. Curiously, some recipes included ingredients with real effects, like ginger and cinnamon, which could improve circulation or digestion. But combining them with heavy metals and toxic substances cancelled out any benefit. Today, the idea of voluntarily drinking arsenic seems absurd, but back then, it was a status symbol. After all, only the rich could afford such mortal luxury. Would you risk a sip of an elixir like that if it promised you'd live forever? After all this, it's impossible not to wonder, how did anyone survive so many dangerous treatments? The truth is that despite the suffering, medieval medicine also paved the way for future advancements. Many procedures, as absurd as they seem today, were born from sincere attempts to understand the human body. Cauterization evolved into modern surgical techniques. Bloodletting, though excessive, contributed to the idea of internal balance. Even trepanation, in rare cases, saved lives by relieving brain pressure. In other words, amidst all the torture, there were small sparks of real knowledge. Of course, we can't romanticize it. Being a patient back then was almost like playing Russian roulette with your health, and trust in doctors came more from faith and desperation than from science. But it's precisely this contrast between good intentions and brutal methods that makes this part of history so fascinating. Today we live in a world where a simple aspirin or antibiotic solves problems that were once treated with fire, poison, and pain. This shows how far we've come, and how lucky we are not to have to face a dentist with rusty pliers. So, the next time you take a pill and feel no pain, remember, things used to be much, much worse. Now tell me, which of these medieval treatments do you think would be the hardest to endure? Leave your comment, like the video, and subscribe to the channel for more bizarre, curious, and incredible stories from human history.